Good morning. I am Dr. Swarupa Mitra. I am a senior radiation oncologist in Rajiv Gandhi Cancer Institute, Rohini, New Delhi. Today I am here to talk a little about brain tumors. So as all of us know, brain tumors are something which makes people very scared, very negative about brain tumors, but yet we do not know much about brain tumors. So I am going to share a little of my experience and my knowledge about brain tumors so that more and more people come to know brain tumors early and can come for treatment earlier. So brain tumor, if we consider, let me first tell you what the brain is. Now the brain is the most important part of our body. It is the largest organ of our body and it is the most complex organ of the body. It controls our daily activities right from our thoughts, our interpretations, our feelings, our memory, what we do, our walking, talking, everything is controlled by brain. So you can understand a tumor in the brain will have impact in everything, in all parts, all activities of our body. So what is a tumor? All tumors are not cancer. Let us be very specific about this. Not all tumors are cancers. Similarly, in brain, there can be different kinds of a tumor. One, it can be classified as a benign or a non-cancerous tumor, and second is a cancerous tumor. Now, what is the difference between the two? Any tumor is a growth in the brain. That means an abnormal multiplication of cells in the brain. That is a tumor. Now, a benign tumor or a non-cancerous tumor, it is a growth, but there is a control in that growth of the cells. The cells do not keep on multiplying for long. So that is a benign tumor and they can be cured. A cancerous or a malignant tumor, here these are the cells which keep on multiplying, keep on growing, and as they grow, they cause symptoms and they disrupt our different daily activities right from our thoughts to our actions. Why do these happen? Because in a cancerous cell, these cancerous cells, they don't die. The normal cell of our body, they multiply, they grow and they die. That is the normal routine of a cell. But a cancerous cell does not die. It keeps on growing till it has its impact and its symptoms. So, a cancerous tumor, brain tumor, and a non-cancerous brain tumor. So, this is one way a brain tumor can be classified. The other way is that, is it a primary or a metastatic? A patient may come to us that I have a brain tumor. But we need to diagnose whether it is a primary. That means, is it arising from the brain itself? So that is called a primary tumor. There can be another tumor which is a secondary or a metastatic. That means the tumor is originating from some other organ. For example, a breast tumor or a stomach tumor or a lung tumor. By tumor, I mean cancer over here. So these tumors or these cancers, they may spread to the brain. And that is when they are called as a metastatic or a secondary tumor in the brain. So we have a primary tumor of the brain or a primary cancer of the brain, a secondary cancer of the brain, a benign tumor of the brain, and a malignant tumor of the brain. So this is all about the classification. Now you may want to know that what is the incidence of these tumors are, how common these tumors are in cancer. So let me tell you, they may not be very common when you compare them to other cancers. But overall cancers, if we see these CNS tumors, it's not only the brain tumor, the brain and the spinal cord, they together, both of them make the CNS or the central nervous system tumor. So this constitutes about 2% of the total malignancies that we see. That 2% is quite a large number when we actually think about it. Now if we come down to India, in India it is about 5 to 10 per 1 lakh malignancies. So it is not very common. And the interesting fact about Indian presentation is that the age group in which the CNS tumors or the brain tumors they present is much, much lower than the brain tumors which present in other parts of the world or the Western world. So if a brain tumor is seen in about 50s and 60s age group in Western population, here in India it is much, much lesser age. So that is the tragic part of it. If we again go into statistics or the numbers, if we see the death due to cancer, it is about 2% of the cancer deaths in males less than 40 years of age. So you can understand what a number it is. And in females it is slightly less. It is about 5% of the total cancer deaths in females between 20 and 40 years. So it is rising, the brain tumors are rising in younger age groups also. Now the children are also not spared. It is the second most common cancer in children. More and more children today we see are suffering from brain tumors, brain cancers, which may or may not be cured. Okay, now when we talk about brain tumors, it is very important to know that how do we know that a patient is suffering from brain tumor or a brain cancer. So what are the signs and symptoms? Now to understand the signs and symptoms, we need to understand that what a brain is. A brain is a big structure, a big organ where different parts of the brain controls different activities. Like there is a part of the brain which controls our sight, there is some part of the brain which controls our thoughts, our movements, our memory. So different parts of the brains have been assigned with different functions. So the signs and the symptoms mainly depend about which part of the tumor, which part of the brain the tumor is originating from. So that is how the signs and symptoms are deciphered, and that is how we understand that which part of the brain is affected from the way the patient presents. Now what are the commonest symptoms? It can be very simple. It can be just simply a patient starts losing his memory, either the short time or a long time. So it's just a lapse of memory. A small unnatural behaviors, abnormal behaviors. So these can be also a presenting feature. But the commonest presenting features are headaches, long-standing headaches. And the headaches can be associated with vomiting. Severe vomiting, severe headaches, these are the very important or common symptoms of brain tumors. A patient can present with a walking disturbance or an imbalance, a gait disturbance which we call. A patient cannot hold on his own, he has imbalance. A patient can also present with seizures, which we call as fits. So there are different kinds of seizures and fits. It may be generalized seizures, it may be just a seizure which affects just a part of the body. So the various kinds of seizures can also be a presenting feature of a brain tumor. Very commonly, a patient may present with a loss of function. Maybe there is a paralysis of one side of the body or just one part of the body, maybe just one limb. A patient loses the function. So these are common symptoms which we need to look for when we want to diagnose a patient or we want to see if a patient is suffering from a brain tumor or a brain cancer or not. So these are the main signs and symptoms. Very commonly, we are asked what are the risk factors. Are there any risk factors of brain cancers or not? Unfortunately, very few. We still do not know why brain cancers are happening. We still do not know why the number of brain cancers are increasing. There have been some speculations. It has been said that yes, radiation exposure to different radiations can be a predisposing factor of developing brain cancers. Family history. Rarely some brain tumors are associated with family history, but very, very rarely. It has been said, or people ask us, that whether a brain tumor is associated with the number of use of cell phones or not. These are very, very commonly asked questions. But honestly, we still do not have any evidences to link the incidence of brain tumors with the cell phone usage. So we probably need to have more research, more study to actually link these two factors, that is a brain tumor with the use of cell phones. So we still do not know. Risk factors, so basically we do not know what are the risk factors. Now diagnosis, how do we diagnose brain tumors? This is very, very important. Whenever for diagnosis, the first thing is that the patient needs to go to the doctor. So whenever a patient suffers from all these symptoms which I have enumerated, one should visit a doctor, whosoever the doctor is, the nearest doctor. What does the doctor do then? The doctor needs to have a level of suspicion. So when he has that level of suspicion, he investigates the patients, and before investigating, he examines the patient. So a thorough CNS examination or a neurological examination is a must. So after a history taking and a thorough neurological examination, after that the doctor sends the patient for diagnostic investigations and a biopsy. So what are the diagnostic investigations? First of all, a brain MRI. The MRI is the first method by which we can localize a tumor in the brain. Many people do a CT scan, but I believe MRI is the foremost and the most important method of diagnosis. After the brain tumor is diagnosed with the help of a MRI, then after that the biopsy is done, because without biopsy we can never label a tumor as a cancer. There are different ways of doing a biopsy. It can be done nowadays. We have stereotactic biopsies where the brain need not to be opened. A craniotomy need not be done. So a stereotactic biopsy can be done. Many times a surgeon may go for a craniotomy and a biopsy. This is all depending on the location of the tumor or the site of the tumor, how close the tumor is to some important structures in the brain. After the biopsy is taken, the specimen goes to the pathologist, and the pathologist finds out what kind of a tumor it is and whether it is a primary tumor or a secondary tumor, that is a tumor which is arising from other parts of the body. So when this is diagnosed that the patient is not a primary tumor, then the system of investigations varies. It becomes a little different. Then a PET CT is required to find out what is the origin, where did the tumor in the brain actually originate. So a PET CT may be required. So the MRI is required, a biopsy required, a PET CT is required. There are a battery of blood investigations and the tumor markers which need to be done. These are the tests for diagnosing and staging of the brain tumor. So after the staging is done and the diagnosis has been made, then comes the treatment, which is the most important part of the brain tumor management. Not all brain tumors need to be seen with a very nihilistic or a negative attitude. Not all brain tumors are cancers, and not all brain cancers are untreatable. There are different types of cancers in the brain. There are many who can be treated well, and the patient has a good quality of life and a good span of life. But we are concerned about those brain tumors which cannot be cured or which are bad. One which is very common is the GBM, which we call as a glioblastoma multiforme. These are the tumor which are probably taken as the harbingers of death. But with better modes of treatment, we have better modes of surgery, radiation and the chemotherapy. These patients also can be given a better quality of life and a lifespan when we compare with the treatment methods given about 5 or 10 years back. Surgery is the foremost or the most important cornerstone of treatment of brain tumor. A good surgery is a must. And any good neurosurgeon always says it is a gross, safe, maximal resection. That is, the resection has to be safe. That means without giving any neurological deficit to the patient. After the surgery is done, once again the biopsy is done. A biopsy or the tissues are read by the pathologist, and then we decide on the adjuvant or the next mode of treatment. These adjuvant or the next mode of treatment could be radiation, which is most commonly done, and chemotherapy as well. Radiation also, there are different modes of radiation where we can give maximum dose to the tumor area or the target area and yet cover or save most of the normal brains. In doing so, the patient, even after the treatment, has a good quality of life without losing his memory, without having any neurological deficit. So these are the different radiation methods like IMRT, IGRT, stereotactic radiotherapy, cyberknife, stereotactic radiosurgery. So that these are the different methods of radiation therapy which can be offered to patients and which we have in most of the hospitals in India. Chemotherapy is also a method of treatment. There are tablets which are given along with radiation, or they can be given later on. Intravenous chemotherapy are also available, but which drug to be chosen, it totally depends on your physician and also on the pathology report. At the end of the day, I want to communicate that brain tumor is, yes, it is something fatal, it is still seen with fear, but yes, not all brain tumors are untreatable, provided they are diagnosed early and a patient is taken to a proper center earliest. Then we do look at a better future for patients who suffer from brain tumor. Thank you.